Hello there, you're watching Proactive London, and joining us today it's Poolbeg Farmers. It's Jeremy Skillington. A warm welcome to you, because you're here with me now, because when you did the presentation with us here for our virtual events, you had an influx of questions. I understand you were bombarded and there's only so much time to cover in that session. So we've got some leftover ones. I've got them in my hand just now from your shareholders and indeed potential investors as well. So we're going to go through them together and make sure we get all of these points covered, so all of these queries can be put to bed perhaps today. Jeremy, so let's get stuck in, shall we? Let's go for this. So the first one is quite simply, how exactly is Poolbeg's business model different?
Again, it's a great question. And thanks again, Katie. Yes, it was a wonderful event last Thursday. I really enjoyed it. As you say, the questions were coming out as fast and furious and ran out of time. So happy to take this extra time to answer these questions. So we're quite different insofar as two things. Number one, the data set that we have, this human challenge data that we got from Open Orphan. Nobody else has this type of data, so we're going to interrogate that, which is good. And I think we're going to model ourselves. There's a fantastic German company, Evotech, who started off as a CRO, contract research group, and then decided to move into kind of drug discovery development and do that little sliver. Let's do an early proof of concept, early proof of mechanism, etc., and partner with pharma. So we're kind of along those lines. And to give them credit, their share price has grown from €4 to over €45 in the last 4 to 5 years. So great success story. So we're going to model ourselves on that. We're going to do the early de-risking, but not the late stage expensive clinical trials. We partner with pharma. So we think that that's quite different to other biotech companies.
Okay, let's move on to the next one here. So do you have any of the original vivo staff on board that were involved in the original development of the immune modulator?
Yes, it's a good question. We do share some staff, which is great. We don't want to lose that, let's call it institutional knowledge. This is a terrific team that identified P38 as an exciting target, in-licensed the program, in-licensed the molecule. And I say with this out-license, with this demerger to Poolbeg, we still have access to their knowledge base, to their intellectual capacity, their experience, which is fantastic for us. Now we do pay them for their time. As I say, it's not a free gig for them, but again, they're very excited to help us because this is something they see potential in. So as I say, but we're not impinging on their existing work at vivo, so they're very busy there as well. So yes, we have access to that. As I say, it's not we don't want to reinvent the wheel. We'll get access to their knowledge.
Okay, so this one is similar in a sense, because it's saying, does Poolbeg get charged for the data they have access to via Open Orphan?
Yeah, it's a great question. Again, as part of the demerger, and again, it always kind of strikes me, Katie, it's only 2 months since our IPO, so we've been quite busy. But prior to that, the demerger, it gave us a non-exclusive license to access this data. So it's all part of, let's just say it's already paid for in the sense of shares. The Open Orphan shareholders get shares in Poolbeg. So this division in species, or distribution in species. So they have, as I say, we have access to this for 30 months. So that's part of the demerger deal. After 30 months, we come back and we renegotiate. There may be more cost to us, but as I say, we'll try and exploit that data set for the next while, since we have the non-exclusive license to it.
Mm-hmm. This one's similar to what I normally ask, actually. What news flow do you expect to see between now and the end of the year?
Yes, we've been very busy in the background. We've been pushing the Polyp 001 along. I like to think in the kind of, let's say the kind of the nuts and bolts, like formulations and manufacturing. This is not necessarily newsworthy. This is the critical work that needs to be done in the background. So that's moving on. But we've got a number of discussions going on right now with artificial intelligence companies. We've explained that the data set that we have is very, very unique, and we're going to use AI to mine that for new disease targets and new disease pathways. So those discussions are going quite well. So hoping to announce some of them quite soon. And then we also said that in addition to working with our internal assets that we got through the merger, we're looking to external assets. We're looking outside science, outside programs, and we've got several discussions ongoing right now and some due diligence going on. So we're hoping to announce before the end of the year a deal that's been done, again, complementary to our knowledge and expertise in virology and inflammation. So that'll be it. And as I said, we're incredibly busy in the background. It's a fantastic team here at Poolbeg, so we haven't slowed down. But yeah, you'll see plenty of news flow between now and the end of the year.
Okay, so deals in the pipeline from the sounds of it. I like the idea of the AI. That sounds really interesting.
Very exciting.
Yeah.